Provision of medical health care for IDPs in Nigeria. Insurgency has become a threat to global peace and security in the 21st century due to the fact that it constitutes the highest contributor to humanitarian crisis in the form of rise in human casualties. Internally displaced persons, refugee debacles, food insecurity, and the spread of various diseases. Food insecurity and internally displaced persons, IDPs, are held constant, while no significant relationship exists when the variables such as loss of livelihood and government response are held constant. Over the years since 2009, the activities of the Boko Haram sect has increased the displacement of people from Borno, Yobe, and Adamawa states in the form of internally displaced persons, IDPs, fleeing to several havens within the nation and refugees fleeing into neighboring nations all over Africa. There have been steady rise in internally displaced persons from Borno, Yobe, and Adamawa states from 2009 to 2010, and of course, till date, the number begins to rise constantly. A report of the National Emergency Management Agency, NEMA, says the number of internally displaced persons as a result of the Boko Haram insurgency in the northeast part of the country increased from 1.5 million to 2.1 million in July this year. Corroborating the report, the United Nations Children Fund, UNICEF, said that more than 1.4 million of the displaced persons were children. The UNICEF report also revealed that nearly 1.2 million of the affected children were under the age of 5. The poor living conditions in the IDP camps has become of great concern. Reports from both domestic and international agencies have shown that these camps since 2009 have lacked adequate facilities, in addition to their poor sanitation and increase in the rise of diseases such as malaria, acute watery diarrhea, measles, malnutrition in both adults and children is also occurring. The worst affected are children, arriving with other health conditions, mental and physical. Children are exhibiting worrying signs and malnutrition, including pregnancy-related issues. These signs and symptoms were recorded in an April 2015 UNICEF report, Missing Childhoods. The report states that the children in the camps showed back then had a level 18 threshold of malnutrition, above the globally recognized emergency threshold of 15. This situation is dire. Further health problems exacerbated by the ill-equipped and unhygienic camps are malaria, typhoid, cholera, polio, and measles. And of course, all these are still endemic and a major public health concern for children. More ailments are undiagnosed, as there are no health checks carried out in some camps. The most neglected of the health issues is the psychological impact this trauma has had on the individuals. Undiagnosed and undocumented depression, post-traumatic stress disorder is clearly visible in a number of IDPs in a few camps visited. There have also been issues of sexual abuse, which necessitates an important investigation. If neglected, this will create health problems such as STDs and the dreaded HIV. The food provided for the displaced people is sadly insufficient and does not meet the requirement for proper growth and development of young children or the sustenance of adults. A balanced diet is extremely essential. Daily or weekly health checks for every individual to ascertain who is in need of medical attention is crucial. A mobile health clinic should always be on standby, as it can be emergencies. It is important for the Nigerian government to look into the healthcare facility provided for IDPs, because these are humans, they are Nigerians, they are our people, they are indeed the future of tomorrow.